Hello and welcome to all our viewers here. I'm Kristen Schwartz, licensed midwife and MC for Gold Learning. And here at Gold, we are in the midst of preparing for our Tongue Tie Symposium of 2020. That's coming up next month in September 14 and 15. And at this time, we're also sitting down with our speakers to get to know them a little bit and talk about not only about the presentation, but also what they're up to with regards to work and life. And with me here today is Dr. Gina Weissman. Welcome, Dr. Weissman.
Thank you so much, Kristen. Thank you. Welcome to all.
It's lovely to have you here. And we have an international audience. That's what I love about Gold. You know, we can be anywhere in the world and listen to presentations and get to know each other. So tell our listeners, where in the world are you?
So I'm located in Israel. I have
Mm.
a private clinic north of Tel Aviv. I work as a lactation consultant, IBCLC, in the local hospital here, where we have a very special population because we have secular Israeli Tel Avivians who have like maybe their first birth at age 40.
Mhm.
And we have a population of very religious Orthodox Jewish ladies who have sometimes 10, 11, 12, 13, 14 children. So
Mhm.
the midwives here are very, very special. They know how to give gentle birth. And because if you want to plan to have like 13 kids, you have to have a very natural and good birth on the first child, and then the second child comes easier. But if you have a C-section on the first one, you might not get to have so many children. So these are very special midwives who work at the Laniado Hospital.
That is lovely to hear, and it's beautiful. Thank you for sharing that with us here. It's always interesting to see how midwifery and lactation professionals practice in other areas of the world. And I have to say, I was honored also to attend a few Orthodox births here in the United States where I practice, and there were beautiful birth, gentle birth, of course. So it's lovely to see that. So thank you for sharing that, and we'll talk more about your clinic. But I want to also know a little bit about your background. You are a dentist. You started your career as a dentist. So tell us a little bit about that.
Yes, well, I was a dentist and I enjoyed it for 10 years. And I think that what happened to me, I had the children. I became a mother. And with each child, I was home a little bit more. I have four boys. So for the first boy, I still went back to work almost every day. And I was teaching
Mhm.
in the medical school in Jerusalem. And then with the second boy, I went back less to my clinic. And then eventually I became an IBCLC because I had a passion to help other women.
And as a dentist and then becoming an IBCLC, you are in a very unique position. I can see how that is interesting, how you can bring your background from dentistry, from your work in the clinic there, and then being an IBCLC, and I'm sure you're probably one of the people who really recognize tongue tie as something to look into, right? I mean, you probably have seen that a lot of children you cared for as a dentist, and also adults probably in your career as a dentist, and then taking that over to when you became an IBCLC.
Well, actually, when I learned how to do a tongue release, it was when I learned as a student. It was on 4 or 5 years old who had problems with pronunciation. But
Hmm.
only after I became an IBCLC, I was more aware of the impact on young babies and the importance of the tongue and the movement of the tongue in other spheres of life, about breathing, snoring, sleep medicine. I was exposed to those areas of knowledge only after I became an IBCLC, which was in 1999.
Hmm, that is interesting to me. So, do you feel like sometimes the need to go back and educate student dentists about, look, this is something important, you need to look into that, or um, how
Yes.
are you working still with other professionals in this area?
Definitely. I have many colleagues in the University of Tel Aviv, and we work together now for more awareness. And it's become, natural over the world now. It's a new emerging profession of learning about tongue tie.
Wonderful. So tell me a little bit about that wonderful clinic you mentioned earlier. You mentioned about the midwives there, and you have a variety of families that are coming to you from all different backgrounds. So describe a little bit, the day to day in the clinic you are working at now. So a little bit about how many people do you see? Just describe your daily life there a little for me.
Well, in my clinic, it's different than the hospital that I work in. I work in the hospital 2 days a week, and in my
Hmm.
clinic, I'm the rest of the day. So we're here now in my
Yeah.
clinic. And so I have two private consultation rooms and then a more larger room for follow-ups. And I see between 10 and 12 women a day for various issues, two or three probably toddler nursing problems, and
Hmm.
then maybe three or four tongue tie issues, and then many mothers who just have regular breastfeeding issues and the latch isn't right. But my prestige people refer to me to help diagnose about when to do a tongue release, because it's
Hmm.
one thing to decide if the tongue is tied or not, and then to what degree, but it's another decision to decide when to treat this child for this mother with this milk supply in this situation at this time. So
Yeah.
that's like my expertise.
Wonderful. Yeah, that is interesting in that you mentioned that I can see different cases, having different necessity depending on not just looking at the baby, but the diet, as a whole, right?
Exactly.
Wonderful. Yeah, and you have presented actually with us before on the topic of tongue tie. I believe that was in the was it to the 2019 symposium, if I'm not
Yes,
mistaken, right?
exactly.
And you are back here in 2020, back by popular demand. It's wonderful to have
Thank
you
you.
back.
Thank you.
And so you're giving us like an update, right? So your title is Understanding the Complexities of Tongue Tie, the 2020 Updates. So talk to us a little bit about that, because I feel like the topic of tongue tie, we have learned a lot, but there's still, I mean, so much to discover, so much to research, right? So tell us about the 2020 updates and what you are excited about in the topic there.
Well, really, Christine, I have to say I have learned so much this past year.
Hmm.
And I feel that now I have deepened my understanding. I'm aware of things that I am not fully understanding. And I know that probably in 5 years we'll say, wow, now we found
Yeah.
out more about that. I think there have been new papers that have come out that have helped us to get a deeper understanding of what
Hmm.
the anatomy looks like. There's a very good new paper about to give us like the idea that there's a diverse flexibility and natural difference between people about this an anatomical feature that we call a tongue frenulum. Some,
Interesting.
some people have muscle tissue inside and some people don't, and it's just connective tissue. And so it's not the same. When we look at a baby, we have to understand that we're not the same in that area of our body, just like we're different in different
Yeah.
areas.
Wow, and that's fascinating. And depending on that, also what kind of steps do we take? I mean, that probably also plays into, do we do a release? Do we don't do a release? So, and it's interesting that you mentioned that, like, 5 years ago, what we know now compared to that, and maybe 5 years from now, we know even more. It's just mind blowing, right? How far we've come and how much we still need to go in the journey there.
Definitely. I think we all agree that if you have a tongue tie, it's gonna be detrimental for your health. Okay.
Yeah.
But we don't agree what is a tongue tie. We don't agree when it's tied or when it's a normal,
Yeah.
diversity of the normal anatomy.
That is very interesting. There is different definitions, and also depending on the provider, who is who is looking at that particular person in that moment as well, and
Yeah.
how old is the baby, or later on, you were telling me also working with toddlers. So there is all these different factors playing in.
Yes, yes. So when I do a tongue release on a toddler, I have popsicles in the freezer and I try to get him, to have this as a fun experience so it doesn't remember it as a traumatic, but that's something different that I do, that I try to, get them to be cooperative and not to have
Right.
general anesthesia, which is also an issue because if the toddler already has to have a tongue release, then sometimes some practitioners give the message to the parents that, okay, he has to have general anesthesia. And with all due respect, if you're, God forbid, in a car accident and you have to have general anesthesia, okay, but it's just a little small procedure. It's just a shame to be admitted in the hospital and have all the hazards of general
Wow.
anesthesia.
Yes.
If I
Yeah.
can get him to do it for a popsicle.
Right, absolutely, absolutely. The less invasion we can, invasive it can be, the better for the family, for the child as well, and it's traumatic also to see your baby there in the hospital, going through all that. It's turning something simple into a big medical procedure there. Yeah, absolutely,
Yeah.
absolutely. Yeah. Oh, wonderful that you were able to sit down with me here and talk about your work, talk about your presentation coming up here. And I quickly want to mention you also did a video guide, right? Tell us a little bit before I let you go about that, because I find that interesting. That is available in 3 languages, I believe. So tell us a little bit about that.
Well, the video guide I did originally, it was like 20 years ago, but I recently released a new version of, it's a series of 10 short videos to
Uh-huh.
help and give a mother, a new mother, everything she needs to succeed in breastfeeding. So currently that's only in our native language in Hebrew,
Okay.
but it would be fantastic if I would translate it. I'm so proud of it. It's my latest project, my COVID-19 project.
Yes.
And I'm really, really happy with the way it came out. I'm getting very good feedback. Each film is like between 2 and 4 minutes, so it's like
Wonderful.
very quick for the young mothers today who like
Yes,
everything instant. And
absolutely.
it's something that she can watch at home at her own convenience, and I'm very proud of it. So I hope to be able to show it internationally too.
Wonderful. Thank you for sharing that. Well, thank you so much for being here with us today. And we are so excited about your upcoming presentation here at the 2020 Tongue Tie Symposium here at Gold.
Thank you. Thank you so much, Christine.
And to our viewers now, you can comment below if you have any questions. Also for Dr. Weissman, you can leave them down there as well for us. And the Tongue Tie Symposium of 2020 will be live on September 14 and 15. We have 2 full days planned for you, 10 presentation overall. And if you would like to find out more about Dr. Weissman's presentation, and the other presentations in the symposium series, we invite you to go to www.goallearning.com. And thank you everyone for watching today, and we hope to see you at the symposium. Bye bye, everyone.